Welcome to Thinking is Contagious. I wanted to talk a little bit about the free COVID testing and what a fraud this is. This is a notification I got, my wife and I. We each got one. We each got two, actually. We had we were COVID tested, and we took both the rapid test and the 24-hour test, and it was advertised free COVID testing. So we did both tests because my daughter had tested positive for the COVID, and we waited for the results, and we got them back, and they were negative. And didn't think any more of it. Then I get this notice that I just showed you. It's for $400 for one test. And then I get this notice. As you can see, this one is for $370 for the rapid test. Said it's not a bill. It's from Cigna, my insurance carrier. It's not a bill, but they want to let us know that this is what they've been billed by the data site, Nomi Health Inc., and that they will let us know if Nomi Health settles for what they paid. I asked them, what did you pay? And they said, we allocated $100 per test. People, do we not see what an incredible business scam this is? Free this, free that. It's exactly what the liberals want you to think about everything being free. School being free, education being free, healthcare being free. It's not free. And here's the proof. $400 and $770 for a swab in my nose, and it was sent out to a laboratory for analysis. Guess what? Yeah, you don't feel it because it's not coming out of your pocket, but guess who pays for all this? We all do. And do you think anyone's questioning how much it's being charged? $770 for 2 tests per person. God knows how many people get tested multiple times, and people say it's free, so they don't even worry about it. But guess what? They're billing the insurance companies. And guess who pays for what the insurance company's overhead and costs are? The people who are insured. Your premiums go up, everything goes up. Who benefits from this? Big Pharma. By selling a vaccine that basically we're beginning to find out is probably not what it's trumped up to be. Okay? But more interesting than this even is something else. Like I told you, my daughter tested positive, and about a month and a half later, she did her physical, her annual physical, and she did blood work, and she advised her doctor that she had had COVID a couple of months earlier, and she did her physical, and the doctor called her with the results, said everything is fine, everything is normal. She says, but you don't have any COVID antibodies in your body. You don't have any COVID antibodies. So she was tested positive for COVID, and she doesn't have COVID antibodies. We're getting free testing done, but the entity that's doing the testing is sending $400 bills to the insurance company to be paid for free tests. Does this smell right to you guys? Do you think something's going on here? Maybe free education really can't be free. Imagine that. Because the teachers got to be paid, because the building has to be open, because the electricity has to be paid for the building. The books have to be bought. Free education, huh? But you don't feel it, right? So it must be good, it must be free. You're all paying for it. We're all paying for it. This is all going on our credit card, okay? At a ridiculous rate of interest. And you know who gets cash up front? You know who gets their cash up front? Big Pharma, the politicians. They all get theirs up front. Politicians get paid off the taxpayer's dollar. Big Pharma is getting paid off the taxpayer dollar because the taxpayer is the one who's going to fund that insurance company. People, open your eyes. There's nothing free, and you're seeing it with free COVID testing, free COVID vaccines. There's always a bill to pay. When all this is said and done, years from now, when they analyze this entire situation, I want to see what the outcome will be, what the bottom line will be for this exercise. Nothing is free, people. Wake up and understand that. Have a good day.